My name is Dr. Michael Chen-Illamos. I'm a family medicine doctor, and I'm also the medical director at the Ossining Open Door site. I decided to come to Open Door because I knew about Open Door when I interviewed for residency programs years ago. When I was getting ready to graduate from residency, I wanted a place where I can call home for me as a family medicine doc. What drives me to continue to do the work that I do every day here. A lot of it has to do with the fact that I've always wanted to be in a community-based atmosphere, and I really wanted to work in an underserved community, and that's where I basically find my drive, is that the work that we do each day is rewarding, and it's remarkable work that we are able to do for our community. So as many of you may know already, we've been embarking on renovating our spaces for Open Door. Where we are currently working out of is our building across the street, 165 Main Street, and we've been there all along, but it has its challenges as we've come to deal with over the last couple of years. So some of the challenges that we're facing right now at our 165 Main Street site is that space is an issue, but not just for meeting for our clinician and care teams, but also for our patients. In the morning before we see our patients, we huddle. That's part of our routine. We get our nurses together, our medical assistants, our clinicians. We all come together to look at the schedule, to how we can best help patients each day. And that space is very difficult to find it for each of these teams. And in such a way that it's both private and also in a way that we also feel comfortable that we can also get the work done. Communication among the care team members, it's difficult in the space that we have. So we use a lot of walkie-talkies and things like that to communicate, because the building is really, it's just multiple rooms, and we don't know where each of the care teams are at any particular moment of the day. We also have programs at Open Door, and we want to expand those programs. We have programs in dental training, we have programs in behavioral health and community health. So we want that space so our patients can really come together and again, really feel welcome in the space that they're entering. I'm currently standing in the new Ossining site at 2 Church Street. It's a beautiful, spacious area that we have here. We really strive for high quality care at Open Door, and that's one of the things that I love about why I work here, is because it's not just about patients coming in, it's about, are we providing everything that we can possibly do for our patients right now? This space will allow us to incorporate our care team members, like our nutritionists and behavioral health. So one of our major goals is really to raise the standard for patient-centered medical care. So that basically means that the patient is in the center. We are thinking about the patient at every point in their care. And it's not just the patient, but also the community, because we know that our patients are part. These are our neighbors in our community, and we are trying to elevate that level of care and the quality of care that we provide. So that is an ongoing kind of a goal that we keep striving for as an organization, and I think our community deserves to get that high quality care every day and to really feel welcome in the place that they're coming to seek their care each day. So as we all know, we have a great space here, but there's still a whole lot of work that needs to be done at 165 Main Street. I think, one of the things that I feel grateful for every day is that we have a community of people who support Open Door and understand what the needs are. And they really take a stand in that way to support us. We really welcome the people in the community, our neighbors, to come in and see what we have to offer each day and the services that we can provide and how we provide those services to the people that we take care of in our community. Without this support, we can't do what we do each day without that. I feel like we're not just thinking about the family that we have right now, we're thinking about the grandkids, the great-grandkids, and what their generation is going to look like in terms of their quality of life and what their health care is going to look like. And we want an area that is really tech-enabled. It's also an area that we can learn, and we can work as a care team, and we can actually maximize how patients really live healthy in a community. And we're really grateful for the support that we have gotten from the community so far, but we continue to need more support as we go through the next phase with the 165 Main Street office. So thank you so much for your support and for your time. It's well appreciated, and I can guarantee that the patients in our community will continue to receive the high quality care that we expect each day.